morning and welcome to UPN Focus. I'm your host, Milt Thompson. And today we've got another wonderful show for you. We want to get back into the world of sports medicine, sports science, physical therapy. And we want to do that by virtue of one of the wonderful organizations that's here right in our community, the American College of Sports Medicine. And we do that with its current chairperson, who is Dr. Barry Franklin. Welcome to our show.
My pleasure to be here.
And we're going to do it with one of my all-time favorites, Marjorie Albohm. And she's got so many titles and had so many titles in her lifetime that it takes me time. I've even got to look it up. What do they call you these days, Marge? They're calling you Director of Sports Medicine and Orthopedic Research, Orthopedics of Indianapolis. Marge, welcome to our show.
Nice to see you again, Milt.
Marge, well, you and I have been through the battles and the wars here in Indianapolis and the amateur sports and professional sports scene throughout the years, the Pan American Game, the National Sports Festival, World Championships of everything of that nature. And you've seen firsthand not only the evolution of a sports industry in this community, you've seen it from your very, very unique perspective as someone involved in sports medicine and sports therapy. That industry too has grown. Tell us a little bit about your background and how you've gotten us to this day here in the year 2000.
I think what you said, Milt, about the evolution of sport and sports medicine in this city has been phenomenal. The American College of Sports Medicine was really the first sports-related organization that located in Indianapolis close to 20 years ago now. And with that sports medicine and science foundation, the rest just grew from there. I think in sports medicine, those skills that we thought were once only applicable to that elite athlete, that Pan-American level or that Olympic level athlete, now we find are applicable to people like you and me, because we need that same care. We can't take time off from our jobs. We can't take time off of our physical fitness program. It's too important to us. So what we used to apply just to the elite athlete now is available for you and me, and that's what is so exciting in the evolution of the practical aspect of sports medicine from my standpoint as a practitioner.
Dr. Franklin, you're a visitor to our town. Welcome.
Well, it's a pleasure to be here.
But you're in that wonderful organization. I know that you've got a big conference that's here in the city where you're having symposia, you're dealing with practitioners, you're dealing with those who might be customers of sports medicine. Tell us a little bit about your background, the hospital you're from in the Detroit area, and then also tell us a little bit about the evolution of the whole business of sports medicine.
My personal background, I was a gymnast at Kent State University many years ago. I have been involved in exercise science, got a master's degree from University of Michigan, a PhD from Penn State, and really have been interested in exercise and the scientific study of exercise and why it benefits people and how exercise brings good things to life. And that's basically what ACSM is all involved in.
And your hospital you're involved with, and your association there?
I'm at Beaumont Hospital in Royal Oak, Michigan. It's a 1,000-bed hospital, one of the 10 biggest hospitals in the country, and one of the preeminent cardiology programs. My real job is that I run a cardiac rehab program. I work with people who've had heart attacks, bypass surgery, angioplasty, and it involves exercise, lifestyle modification. And we do treadmill testing. We evaluate people in terms of cardiovascular fitness. So it's really pretty much in tandem with the mission of the American College of Sports Medicine.
Well, when you were in med school, it's probably like when I was back in law school. There probably wasn't a such thing as a specialty in sports medicine, just as there wasn't one in sports law, but now I hold myself out as a sports lawyer. You hold yourself in sports medicine. What really is sports medicine? Is it a combination of a lot of skills, or is it really a marketing technique, or what is sports medicine, and how would you define it?
I guess I would define it as applying exercise, physical activity, and lifestyle change to improve our life, to improve the quantity and quality of our life. And that's what ACSM is all about. It's looking at physical activity, the health benefits, the fitness benefits, and striving to get people on exercise programs that are safe, effective, and that the million-dollar question, as Regis would say, is that they can apply long-term with it. That's really what we're talking about.
Health and fitness is something that's kind of a buzzword anymore, Marge. It's because of now having so much information thrust upon us from all kinds of commercial enterprises, the drug companies. We can take a pill, and before you know it, we're slimmer, we're healthier, at least the perception of being slimmer and healthier. I think I know better, and I think our audience would like to know better. What's your caution to them, given your background in physical therapy and in sports science and medicine? What kind of information would you tell them about these shortcuts?
Well, I think throughout our entire culture and into the future, we will always be deluged with quick, easy fixes. It's our human nature to look for that quick fix, just like you said, to get fit quickly, the easy way out. We know that it can't be that simple. I always tell clients and patients and physically active people when they ask that question, I say, go to scientific resources. What you read in the over-the-counter journals, what you read in the grocery store line, what are headlines sometimes in our newspapers. It's not information that you can rely on. I think the best source of information is the American College of Sports Medicine and the guidelines that they have for the everyday person in physical activity, what their goals should be, what warning signs are if you're doing too much, how to take care of yourself to reach your fitness goals. They've become very practical in their information. This organization is so scientifically based, but they take that information and make it make sense to you and me and the everyday person. They have some outstanding publications, and because they're here in Indianapolis, that information is available to all of our residents and citizens readily. So we should take advantage of that.
Dr. Franklin, tell us about the college.
I'm going to recruit you to our board of trustees, by the way. I think you're terrific. The college is marvelous. I've been a member for 30 years. The college has over 18,000 members in 70 countries. The disciplines are really three basic types of individuals. In medicine, about 20% of our members are physicians, basic and applied scientists, and education and allied health. I'm from the latter, education and allied health. And really the beauty of ACSM is that it's a multidisciplinary organization with people from all walks of life involved in furthering the quality of life with exercise and physical activity.
Is it equivalent to a trade association or a professional association whereby information's exchanged? Are the members competitive, or do they assist in learning new information? Or how would you characterize the people that make up the ACSM?
Mort, it's a continuum. We have people in the practice field, practitioners, as well as some of the preeminent scientists in the world who are looking at exercise from a molecular biology standpoint. So really it's the whole continuum, and these individuals, all 18,000, work together in terms of answering the questions. We publish our research in the preeminent journal in the world in physical activity, that's Medicine and Science and Exercise and Sport. We have another journal called the ACSM Health Fitness Journal, which is geared to the practitioner, the personal trainer, the exercise fitness enthusiast. And then we publish things called current comments, which are basically for the lay public to get the information out, transforming complicated scientific research into things the average person can understand and appreciate.
This is a fascinating subject matter, and I know that our audience is going to hear a little bit more about where the rubber meets the road, some of the practical things. We've been talking a little bit about the kind of the theory that surrounds sports medicine, its genesis, what the college does, its organizational and structure and roots. But for couch potatoes, for those out there who are really looking for a professional association like that one, and also like the Orthopedics of Indianapolis, where you are actually providing a legitimate service to those who are interested, I think we'll want to hear a bit more about that. And we're going to do that right after we have these short messages. And welcome back to UPN Focus. We're talking about sports medicine, sports science with very, very good friend Marge Albohm, and Dr. Franklin here is the chairman of the board of the American College of Sports Medicine that has conferences here in Indianapolis, and we're delighted to have your expertise. But rubber meets the road sometime. People really want to know what it is I do, what happens if I get injured, what type of injuries would require specialists to be able to look at it. The Orthopedics of Indianapolis, Marge, tell us a little bit about that organization, what your role is, and what you do every day.
Right. Orthopedics Indianapolis is the largest orthopedic practice in the Midwest. We have 60 orthopedic surgeons practicing in all orthopedic subspecialties. We're noted in sports medicine for our premier physicians who treat the world's best athletes. We've covered the open wheel kart IRL Indy racing for 25 years at all of their races, including here. Team physicians for the Indiana Pacers, the new WNBA Fever, the Indians, all of that. So lots of sports medicine experience. And I think the average person needs to know where those specialists are. My role with the practice is Director of Sports Medicine and Orthopedic Research. And that's an interesting combination because we're very research-oriented, and it's the research, as Dr. Franklin demonstrates with his role in the American College of Sports Medicine, that really answers the questions for you and me about what we need to know about how to take care of ourselves, how to prevent injury, and then how to properly manage that injury. The physician is there to make that diagnosis and advise you, but every person needs to take responsibility for their own health care, for their own physical fitness, and for their own injury prevention. We have a lot of information available to physically active people on how to prevent injury. A lot of that has to do with strength, endurance, developing a good fitness program. Being physically fit helps you prevent injury. When that injury occurs, we have great orthopedic resources at Orthopedics Indianapolis to help you with those.
Got this publication, second edition of Your Injury, a common sense guide to sports injuries. Wow. Tell us about this publication.
The greatest thing about that publication, Milt, is that it's filled with pictures. It's a picture book. And so
I
when
need that kind of book.
people say, oh, you wrote this book, Marge, no, we took pictures, lots of pictures, which says 1,000 words. We've gone through the body, we've highlighted key injuries, we've shown pictures of a little bit of anatomy, what that means, but basically ways to prevent that injury and then ways to rehabilitate that injury, getting you back to your level of fitness as quickly and as safely as possible. The same goal we have for that Indiana Pacer who's playing tonight.
Dr. Franklin, you mentioned your area primarily in the research side of it. Where do you see the future of sports medicine in a research context? Are we there yet? Do you see that mountaintop, or are we still a long, long way away from having the perfect human body?
No, I think we're at the tip of the iceberg in terms of where we are in sports medicine and really helping people help themselves. To me, that's what ACSM is all about. Working in a medical environment for many years, increasingly we're seeing cutbacks in terms of the number of physicians, the number of medical staff, and I believe increasingly the responsibility for healthcare is going to rest on our own shoulders, what we can do for ourselves. I think Dean Ornish said it best, and that is that what our medical system can provide is probably far less important than the lifestyle choices we make on a day-to-day basis, whether it's diet, whether it's exercise, or the combination of both. I think the other exciting thing relative to sports medicine is that for many years we focused on the marathon runners, the intense joggers. Now we recognize that moderate intensity exercise, which for us is 2.5, 3.5, 4.5 miles an hour. They're not that fast speeds. Walking speeds for most people can achieve tremendous health benefits, and the Surgeon General and ACSM say it's 30 minutes, accumulating 30 minutes of exercise on most and preferably all days of the week. That's also brand new in terms of sports medicine. We used to say you got to do this all at one time, 30 minutes, don't stop. Now we know, like money in the bank, it's 3 10-minute sessions gives you the same benefit as 30 minutes. So it's cumulative, and that's a new axiom in sports medicine and preventive medicine.
Where is all this issue between in what I've inherited, my genetics, versus that of what I might be able to do in a preventive way, if in fact I have bad genes, if you will, in order to help stave off long-term or chronic kind of illness?
Well, you're highlighting an excellent point, and there's no question genetics do play a role. And once in a while when I see a young heart patient at the age of 40 or 42 whose father died of a heart attack in the mid-40s, there's no question, but I would look at it from the standpoint that oftentimes there were bad lifestyle habits in that family. That person smoked, their father smoked, and so on and so forth. And increasingly, I believe we really do control, to a large extent, our own destiny when it comes to health care. And that's really been shown in terms of cancer, heart disease. Diet and exercise are critically important, and that's what ACSM is all about, promulgating diet and exercise in terms of preventive medicine.
Marge? He said something there that's pretty interesting to me, that whole thing. Orthopedics, they've been in my life. I know them too well. I've supported most of their careers around here as a younger athlete at one time. I ran through so many walls that I had the plaster casts all over my bodies and the wire jobs and those sort of things. So when I think of an orthopedic, I think of somebody who's going to fix stuff.
Right.
But that's not really the current trend, is it, in
no,
orthopedic
and I think
medicine?
your question on what's happening in the future technology-wise, totally, dramatically dramatically impacts the profession of orthopedics and how we look at sports injuries. The technological advances in surgical techniques in repair of something that needs a surgical approach, phenomenal. Tissue engineering, using tissue from our body to re-engineer parts that go back in our body, phenomenal. Ligaments that we once had to use other parts or structures to make do or make a new ligament, now we can use from an external tissue source. And artificial meniscus, cushions, ligaments, muscle, it's just going to mushroom. The future is phenomenal in terms of technology and how this will help repair things that need repair, speed recovery, and return us to a functional level that we've never known. You know, when you have a serious knee injury, when you and I played, we probably didn't play at the same level again, if at all. Or now our knees creak pretty bad and we're saying, you know, what about that total joint replacement coming soon? For the future, starting now, we'll delay that arthritic progression. We'll be able to get you back to a higher functional level because of the surgical advances and the techniques and technology that has come to that field.
We're at the tip of the iceberg, Dr. Franklin, but this is a moving, fast industry. Things are changing rapidly. Do you ever get into philosophical discussions about the morality, if you will, of this significant advancement, cloning, the tissues of others? We've gone way past that in the last 10 years. And if we project out where we are today, we're going to have to address those significant issues relative to your research.
I'd agree with that, and it highlights a point that you made, Marge, and that is we're living longer, and we're seeing people in their 80s and 90s now undergoing coronary artery bypass surgery, and of course the socioeconomic ramifications are huge. Because of these changes, we are living longer. I believe the quality of life is better, no question about it, and we have the capacity now, relative to some very profound changes, of literally reversing the aging process by about 20 or 25 years with an exercise program. I typically tell people, as you age, aerobic fitness decreases about 1% per year. So over a 20-25 year period, by the time you hit 60, 65, aerobic fitness has decreased 25%. That's the bad news. The good news is if you start an aerobic exercise program, you'll improve aerobic fitness by about 20% in 3 months. So literally, from a functional standpoint, you can reverse the aging process. There's a functional rejuvenation of 20 years, which is really quite phenomenal.
So if I started 20 years ago, I would have an opportunity to add a whole lot more fitness and health as we go. This is so intriguing, but it almost kind of leads to me one of those real provocative questions about taking advantage of these wonderful advances and opportunities. Is this a sports medicine only for those with the wherewithal to take advantage of it? I want to ask that question and a couple more ones right after these important messages. And welcome back to UPN Focus. We're talking with very special guest, Dr. Barry Franklin of the American College of Sports Medicine, and Marge Albohm from Orthopedics Indianapolis. And before we left that last segment, we were obviously talking about some of the morals and the access to this high-tech care, the degree to which there's genetic engineering and cloning of primates, and where all of this is kind of headed. Does the underclass have an opportunity to take advantage of this, or are there things that anybody and everyone, no matter what their social economic condition, can look forward to relative to this whole industry, if you will, of sports science and medicine?
I think it's available to everybody today. I truly do. The things that Barry has outlined in terms of physical fitness and the guidelines that the American College of Sports Medicine promotes is available to everyone today, regardless of age. From a treatment, prevention, technical, practical aspect of sports medicine care, that's also available to everyone. Again, we want to take those skills that we applied to that once elite athlete, that once elite group of people that were different than us, and bring it to the level of the everyday person, and I think we're doing that.
Well, I know in the judicial system say you can buy yourself justice. I want to know, can I buy myself a few more years of life?
I'm not sure you necessarily have to buy it, Mort. I think if you're willing to make the commitment, the price is really pretty low in terms of the appropriate selections, in terms of diet, and some mild to moderate exercise on a regular basis. We have unequivocal data. ACSM has unequivocal data that the more physically fit you are, the lower the subsequent morbidity and mortality. As you live longer, the bottom line is. So the evidence is incontrovertible. If you exercise and you're physically active, both the quality and quantity of your life improve.
You know, being a sports fan, I hear of steroids, I hear of andro, I hear of supplements, I hear of bodybuilders, I hear of spleens falling out from East Germans and others after being detected with this sort of thing. Where are we headed? Have we figured this out as a community, and what are your organizations doing to get the word out that these artificial enhancers are really not healthy?
I think it goes back to what you said initially, Milt, about wanting the quick fix, wanting the quick way to beat your opponent. And I think that competitive nature is in everyone. Unfortunately, I'd like to say we've made as much progress on that arena as in some of the other things we've talked about. I feel that those things that were only used at the higher level are now being used at much lower levels, junior high, middle schools, high schools, not illegal substances, but things that are over-the-counter supplements that coaches, personal trainers really advocate with these young people without looking at the research. The research is there. It's just not as glamorous as the effects that you see in the sport magazines with some of the sport heroes. And again, going back to the research that a scientific group performs is what we need to encourage.
Do you agree with that, or you have a different take?
I tend to agree with you. I think by and large, many of these supplements, in some cases the supplements may enhance performance to some extent, but we really don't have what we call randomized controlled trials where people took a drug and then they took the drug, took a placebo that looked like the drug and actually compared it. In other words, if you give me a pill, Mort, and you say your performance is going to improve, it may just improve if I take that thinking it's going to improve when you're actually giving me sugar. So we need research that really substantiates those ergogenic aids as we're talking about. And steroids do have a downside. That's one thing I would say unequivocally. They increase the incidence of cancer, liver disease, and plummet the HDL or good cholesterol. So there is a downside to those things.
And you know, even if it is just psychological, I've got those athletes that come to me every day and say, so what, Marge? If it improves my performance, if it is just a placebo effect that improves my performance, how can I not take this? So although the literature may be there.
How time flies when we're talking about such a fascinating subject. You know, we've got a lot of things going on in our community. We're going to find out a little bit more about them with our community calendar.
Here are some events in our area for you to focus on. Join the Westfield Lions Club for their annual fish fry on Friday and Saturday, July 28th and 29th from 5 to 8 p.m. The fish fry will be held at the Lions Club on West Jersey Street in downtown Westfield. Enjoy fish, pork barbecue, hot dogs, and many other food favorites. Tickets are $6 and can be purchased at the door. There will be a special foster parent training session provided by the Specialized Alternative for Families and Youth. Training is scheduled to begin July 6th from 6 to 9 p.m. Call for more information. And applications are now being taken for Happy Hollows Children's Camp attendees. This beautifully wooded 788-acre facility is located near Nashville, Indiana. The camp is open to boys and girls between the ages of 8 and 13 living in Marion and surrounding counties. We'd like to hear from you. Send us your event 3 weeks in advance to be part of the UPN 23 community calendar.
Dr. Barry Franklin, Marjorie Albohm, thank you so very, very much for being on our show. Information was very, very important. I know our audience is going to enjoy hearing what we've got coming right here on this station next week. We'll see you next week here on UPN Focus.